Thanks, Claire. I'm a little nervous, so I wish I could have Dr. Rui come and do some acupuncture on me to help me relax a little bit. I'm here to speak of the benefits of Nurse Navigators in mesothelioma. So there's a couple of definitions for Nurse Navigator, and so I put a couple of definitions, and they're all essentially the same. And it's a medical professional to help patients, their families, and caregivers from the initial diagnosis through all of the continuum to help them, get access to care, to help them define or, help them understand the different concepts, the different special physicians are going to see, and to make informed decisions on what they're going to decide. So this is another one by the Oncology Nurse Society, and it's individualized assistance offered to patients, families, caregivers to help overcome the healthcare system barriers. Our healthcare is a big problem, and every system, whether it's Kaiser, another HMO, the VA where I'm at, we all have barriers, and if you can have someone who understands a system, that's really half the battle. To know who to contact, to know where you're going to get your access, how and whatnot, even small details like where you're going to park, where you're going to stay, that sort of thing. So Nurse Navigator is not really a new concept. It actually dates back to 1990s. Dr. Freeman started the Nurse Navigator program for underserved population women with breast cancer. And what they found, it was that they actually found that there was a 5-year cancer survival rate in these patients that went through the navigation system. So it's not new. It actually has been around longer than 25 years. So in 2001, there was a report that came out that said that actually that all patients, across all Americans across all socioeconomic levels had a lot of barriers to healthcare, cancer care. So it wasn't unique just to low socioeconomic status. It's actually just across all Americans. You have barriers to access quality care. And then in 2005, President Bush, he signed legislation that in patient navigation projects to get federal funds to offer patient navigator outreach to chronic diseases. And cancer is a chronic disease because a lot of people are surviving and needing care for many years. And in 2012, the American College of Surgeon Commission on Cancer, they set a new standard that in order for a program to be accredited by them, you need to have a nurse navigator. So it is making a big difference. Okay. So what are the qualifications? So there are some navigating programs that are not nurses, or actually they're called patient navigators, and they're people that were trained, and they may be cancer survivors, or they may be family of someone who had cancer, and they're there to help get patients with a new diagnosis to get through the healthcare, to let them know what's going on or share experiences with them. So there is a spectrum of nurse navigator programs. There is a lower one where it might be, or I shouldn't say lower, but there's one where it might be of a layman person, not necessarily a medical provider. And then there's some that offer navigation from their diagnosis until treatment. Some is from the initial diagnosis all the way until the end of life or whatever. So there are a spectrum in it. And then in nurse navigators, in the qualifications, it is a registered nurse or advanced practice nurse, people who have either a bachelor's or a master's in nursing. And we get certified through a national commission. And we have essential sets of skills that help us assist patients on what to expect, who they're going to see, and help them define all these different studies and diagnoses and terms that they're going to be hearing really soon. So these are some of the terminology that all of a sudden people get a life-changing diagnosis, and if they don't have a nurse navigator and they go see their oncologist or primary care provider or pulmonologist, whoever did the initial diagnosis, and they might hear some of these terms and not all of them. But as they go through and see other specialists, they'll hear, cryoablation, sarcomatoid, epithelioid, radiation, all this stuff that is really overwhelming, and in particular to someone who just obtained this diagnosis. So we, as nurse navigators, can help patients, describe all these different terms and when do they come in the continuum of treatment and management. We are often the first contact for a patient. A lot of times I get patients, I'm at the VA, so I get patients from other parts of the country letting me know I have mesothelioma, and my doctor's telling me I need to have chemotherapy and that I have 9 lives to live. Like, that's a typical mesothelioma call that I get from patients. So I really help them, explain to them what we have to offer, and that it isn't just chemotherapy. I explain to them the disease, is it epithelioid, is it sarcomatoid, what side is it? Is it limited to above the diaphragm? Are there any other areas? We help them, how to get to us. At the VA is, who to contact, how to make arrangements to get them to us, get them, travel reimbursement, get them out to see us, to get to specialty care. We also educate them on the different options of treatment, and we offer, I think, a lot of hope to patients, because a lot of times when they get this diagnosis, it's very, it's just life-changing, and they get very depressed. And so when they speak to us, and at least I feel that whenever I speak to them, we hang up the phone and there is hope. There is something okay, there is something out there. There's people that care. There's people that are looking out for us. So we offer a lot of support. We answer all these questions. And this is really good, because by the time they see Dr. Cameron and he talks to them, we've already explained a lot of things. And so when he has a more in-depth conversation about their treatment, about other things, he doesn't have to spend time explaining all the different little details that we do. So there is literature to support that the benefits of Nurse Navigator improves the timeliness and continuity of care, reduce emergency department visits. I get lots of calls from patients before and after surgery regarding how they're feeling. I let them know whether it's normal, abnormal. Maybe they just need, stool softener or something like that. So I can help them with that stuff. They don't need to come to the emergency room. It's not a burden. It's not as expensive than to come to the ER, to be admitted for something. We can prevent some admissions and ER visits just through a phone call. Improve wait times between visits and tests. So if they come and see us and Dr. Cameron recommends a biopsy or some other treatment, instead of putting the consult and waiting for that other team to eventually call the patient, we make sure that the next day we're on the phone calling other services and making sure that this patient gets in through the system a lot faster. So that way the patients get pretty good care. And the fact that we're available, patients call us all the time, and we return calls and we listen to them, and that really increases patient satisfaction, because they have someone to call, someone to communicate, someone, even if it's just to listen, to say I couldn't sleep last night or something. And it also, compliance and treatment program, it improves it, because we're kind of coaches also. We tell them, make sure you're taking this, try this, try that. With interferon, it's like, well, maybe try it at night, take it with Tylenol, or do this, or, we're there helping them, and so it does increase compliance. And then patients' anxiety and physical pain. Again, that's, if people are anxious, it's gonna come out in other ways. It could be in pain, it can be in other ways, insomnia. So if we can let patients know, this is normal, it's gonna get better, then people start feeling better, and they can enjoy life. So the overall goal is really just to decrease morbidity and mortality by eliminating barriers to timely access to cancer care. Nurses navigators can help decrease the morbidity and mortality by eliminating the barriers to access cancer care, to understand all the terms, to understand why the diagnostics that they're undergoing, to understand the treatment, to be there for them, to answer questions to them and to their families, to their caregivers. And these barriers actually they can be anything: financial, psychosocial, logistics, just letting them know how to get to us and how to maneuver through a very, very complicated healthcare system. And that's it. My talk was very short and sweet.